Hi, I'm Dr. Hampton Howell at Salem Plastic Surgery, and we're going to be talking about Botox and Juvederm today. And we just wanted to do a short video to explain that to people who a lot of times have confusion about the two different products. So Botox is actually a product that is typically put in the forehead, in the glabella here, and around the crow's feet, where people get the lines across here, and they get the lines here that they refer to as their 11s. And it paralyzes the muscles that make those lines when people animate or they're stressed at work or whatever the case may be. Now, Jeanette here doesn't have many of those. We're not actually doing the Botox on her today. But the fillers that we're going to focus on today, such as Juvederm Ultra Plus, those are hyaluronic acid fillers, which is one of the normal components of our skin and soft tissue. And those actually are filling in volume. So these lines are not from volume that's lost, they're from muscles that are overactive. The filler goes in here and here for Jeanette. Sometimes other people need it along here, down here, sometimes at other areas as well. But it's for where people have lost volume over time, and so it's two different core reasons for why we use it, and thus the different reason for the places that we put it in. And we just want to show that it's a relatively simple, straightforward procedure that you can come in and have done without anesthetic. It's very tolerable. And we're just going to show how it is on Jeanette. So she's already been cleansed and appropriately prepped, and we're using Juvederm Ultra Plus today. And we're going to start here in the nasolabial fold, which is simply the fancy way of the edge of the nose down towards the corner of the mouth. And we'll just do a series of little injections here. And we're just putting in little bits at a time as we're putting that in there, allowing it to go in nice and smoothly. And then we just kind of gently work our way down. And you can see that we're not having to peel Jeanette off the ceiling or anything. She's doing great. She's not had any pre-medication or any numbing agents. Now the benefit of this is that it does have numbing mixed in with it as part of the manufacturing. It has lidocaine that's built into it, and that helps give an additional benefit and takes the edge off, so to speak. And we're going to turn her and work a little bit on the other side. We'll go back and put a little bit more there as we need to. So again, just a series of small injections to lay the product in there, lay it in nice and smooth. We'll gently massage it and adjust it as needed. And that's laying in there very nicely. I'll have her turn back over this way. Do just a little gentle massage along there. Same thing over here. Add just a little more over on this side. Most people have natural asymmetries. One side will be deeper than the other, might have a little different configuration, might be more narrow or more wide. And so you just lay it in, kind of customized for each person so that it lays in there nicely and gives a nice even result when you're done. And that's laying in there real well. And she has a small little area here, not real commonplace that we put it, but just where she has a little additional scarring, and so it can be used for places like that as well if you just need a little bit of extra volume there. And so we're going to get that right into that spot. And just kind of gently smooth that out too. And that just helps with a little area where she has a little bit of a contra-regularity from where she'd had some previous scarring. Good. And Jeanette, I'll just have you hold a little finger right up there for me. And we just kind of assess and see where we are. Do final little adjustments as needed. And again, as we're putting in the final adjustments, I like to do just a little bit of massage just to give that fine tuning. The other thing with fillers is that kind of what you see is what you get, in the sense that we filled it in, it's there, and you can see the result. Botox will take several days, up to about 5 days, to see the effects of that, and that's just it having its natural effect that it's supposed to have. Alright, let's see how everything's doing there. And we're going to do a little bit more over here. And that's pretty much all there is to it. Pretty simple, straightforward. We'll do the last little bit of adjustments there and then take a look at her here in a second.